Welcome to Pennsylvania Newsmakers, and thanks for watching. Well, it's New Year's Eve weekend. I hope you have a great new year coming up. On this program, we're going to take a look at how opioid abuse now is injuring children in the state of Pennsylvania. But first, Secretary Ted Dallas joins me for the state of health care in, what else? The Commonwealth of Pennsylvania. We'll be back in a moment.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Secretary Ted Dallas, he heads the Department of Human Services. He's joining me for a discussion, a little update, if you will, Mr. Secretary, on the state of health care. There are a number of things I want to talk about, but let's talk a little bit about the Affordable Care Act. Republicans insist they're going to repeal it. Replacing it may be a lot more difficult. Give me your sense about how the Affordable Care Act is working in Pennsylvania. Who's covered, who's not? And there's been an increase, as you know, in the cost for premiums for individual policyholders. Talk a little bit about that.
So first, Happy New Year.
Yeah, Happy New Year to you.
The part of the Affordable Care Act or Obamacare that the Department of Human Services deals with is the Medicaid expansion. So there are two parts. There's the Medicaid expansion, and then there are the exchanges.
Right.
Pennsylvania, people in Pennsylvania can go to the federal exchange. So that really isn't something that Pennsylvania has direct participation in. The Medicaid expansion is what Pennsylvania did. Through the Medicaid expansion, it was 680,000 people now have health care that never had it before. That is, most of them tend to be a little younger. They're under 40. They're women. A lot of times they're single moms. If you're thinking about the person who might be your waitress or the person who cuts your hair, those are the folks who get it. At the end of the day, is probably the largest expansion of health care at any time in the state's history. And as a result, the number of people who are uninsured in the state are dropped at all-time low. It's 6.4% for people across the state, just generally, and for kids, it's even lower. It's in between 4 and 5%. So those are both historic lows.
Yeah, I don't think there's any doubt about that. I mean, there is this debate over the Affordable Care Act. Obviously, it still remains, in the polls that have been done, sometimes it's a little more popular, sometimes it's unpopular. But have you seen any direct effect on health care as a result of it? I mean, obviously more people have coverage. It's more expensive. What is your sense about the long-term future of health care? This is something that I know you're involved in the Medicaid part of it, but we also got Medicare, which is the lifeblood for millions and millions of senior citizens across the country. What's your best guess about the future of health care?
So I think first, the two biggest impacts you'll see in Pennsylvania, the first one is that hospitals that had a lot of folks who were uncompensated care, they're now being paid through Medicaid. So that's helped them with their margins, and hospitals are doing better. And the second thing is the opioid crisis, which I think you said we're going to talk about a little bit later. Of the 680,000 people, 63,000 of them in the first year got access to drug and alcohol services. So it was also one of the biggest expansions of drug and alcohol services in the state's history. So the impact of that, and whether there's a repeal or a replacement, they're all huge impacts for hospitals, for folks who have a substance use disorder, all those sorts of things. In terms of the future, I think that it all depends what happens in Washington. So right now, I think there are a lot of folks talking about it, but I'm not sure that anyone knows exactly what it will look like, if there is a repeal, how that happens, and if there is a replacement, how does that happen? For us, though, we know there are huge consequences. There are literally over 500,000 Pennsylvanians who get their health care who could be interrupted, including folks who are in active treatment for a substance use disorder. Right? And there are huge impacts when you think about just the economy of Pennsylvania. There were over 20,000 new providers added to the system to provide services to all those folks who have health insurance now. If the Affordable Care Act were repealed, we would likely see a decline in the number of providers we have, a decline in the number of doctors we have in the program, and I think it would have an impact on our employment as well.
I think the problem, as I get my sense about it, is that you need a majority of the votes in both chambers of Congress to repeal it, but to replace it, because of the Senate, you probably need 60 votes, as you know well, to get over the filibuster. And then you've got the problem of the cost. The cost of any replacement, if the incoming Trump administration says they don't want to force people off of health care. In other words, they don't want to take it away. Yep. They just want to replace it. But then you have to figure out how to pay for it, don't you?
So I think it's going to be
paying for it's always the problem.
Absolutely, and I think that it's also much more complicated this time. In the past, I think the 30 or so times that folks have voted to repeal it in Washington, they always knew the president was going to veto it.
Right.
So this time the president may not veto it, and has indicated that he probably will sign it. So I think they have to be a little more careful. What I've most often heard is they will go for a repeal and then try to have the replacement be several years down the road and keep the current system in place. And that presents all sorts of challenges too, but I think it's one of those things that you will see the Affordable Care Act, more and more folks, there were a huge surge in folks who applied after the election. That number will continue to grow, and whatever that replacement is, there's going to be a pretty high bar to continue to cover the same number of people.
Yeah, the other thing that voters support, I've done surveys on this, as have other people, is, you know, if you're a millennial, you stay on your health care, your parents' health care. The federal law is 26. We have 29 in this state. I mean, which is surprising that Pennsylvania took the lead. You don't have to. We're not often the first in the nation. You don't have to comment on that.
I will not comment.
You can pass on that one. I don't want to get you into trouble. And the other one is pre-existing conditions. You have to have affordable health care. It's not just a question of can you get the coverage, but it has to be.
And I think you've really hit on an important thing, too. A lot of folks, if there's a replacement, will concentrate on the number of people covered, but you also have to look at the quality of coverage. There were a lot of folks who were in things called high-risk pools before, and a lot of folks had insurance really in name only before the Affordable Care Act, and what that insurance covered really wasn't a lot. So even the folks before the Affordable Care Act who said they had insurance, what they saw was they had huge deductibles, they had very limited coverage, and if they ever did get sick and they needed it, the insurance they had didn't even cover what they needed.
Chatting with Secretary Ted Dallas. When we come back, I'm going to talk a little bit about the Children's Health Care Program. It's called SCHIP. We'll get into that and some other things after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, now celebrating 100 years as the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back. I'm chatting with Secretary Ted Dallas. He heads the Department of Human Services in Pennsylvania, in Pennsylvania, may I add. All right. Look, one of the things that Pennsylvania took the lead on was the development of the Children's Health Care Program. It's something that former Governor Bob Casey, it was universally applauded. Well, first of all, explain to folks what is that program?
CHIP is health insurance for kids and for families that make a little too much money for Medicaid.
Medicaid, right.
So they're not low income enough for Medicaid, which is health insurance for more low income people. You can get health insurance for kids, and depending on how much money you make, it's either free or you pay a premium depending on how much money you make.
Right. So let's talk about it in Pennsylvania. Are Pennsylvanians, I know I have the numbers here that your department gave me, Pennsylvanians really use this, don't they? And there's been an expansion of it within the last year or so.
So, as you mentioned, it was under Governor Casey. Whether you're a Republican or Democrat, every governor has been a big supporter of the CHIP program. It was initially under the Department of Insurance. 1 or 2 year ago, it was the General Assembly moved it under my department, the Department of Human Services.
Right.
And since we've made that move, we've been able to make the program a little more efficient than it was before. And that's simply because there are a lot of folks, about about 10,000 every month, believe it or not, who go back and forth between Medicaid and CHIP. So you might make a little bit less one month or make a little bit more, right?
So let me stop you here. So this is, because it's income related, you can bounce back and forth. That can't be easy. I mean,
no.
I don't mean it. I mean, we all have health, I have health care coverage, you have it, and they change here, change there. I have no clue anyway how to follow it anymore. It's complicated, but that must be a nightmare.
So it was difficult. Luckily for us, we have some pretty good IT systems at work. It's called a healthcare handshake. It moves folks back and forth, and it's
wonderful.
hopefully a little seamless to them.
Yeah.
Now, where it was a problem was if CHIP had a different policy than Medicaid. So if you have a kid who needs braces and it's covered under CHIP but not covered under Medicaid and back and forth or in different circumstances, that could prove difficult for a family. We've been able to straighten all that out. We've been able to increase the number from 150,000 kids to about 168,000 kids in a year. We've taken the amount of time that it takes to process an application from 40 days down to 1 day. And then the best part too is combining those two IT systems is actually going to save us money. So starting in 2018, it'll probably save us about $3.5 million a year having one system instead of two different
And you have
ones.
this expansion, 63,000 new eligibles access drug and alcohol treatment.
That is, I think,
how important that seems.
The opioid crisis is something that has unfortunately probably affected almost everybody in the Commonwealth. There are folks who work for me who have relatives and siblings who have been affected by the opioid crisis. It's sadly something that none of us really can afford not to look at. It used to be an urban problem or a low-income problem, but it really is all over the place now. And if you think about it, 63,000 of those folks who got substance use disorder treatment, the folks who got into treatment, 75% of them did it in the first 2 months of the Medicaid expansion. So those were folks who probably had a substance use disorder and an addiction and didn't have health insurance.
Didn't have any coverage. So, I mean, we're going to talk about that with Cathleen Palm, but there isn't any doubt about how serious this problem. And as you point out, I mean, just all of us in our own personal relationships with people. Oh, somebody in this family has that problem, and it's something that fortunately is beginning to get a lot more attention.
The governor, I traveled with the governor when we were doing some announcements about Centers of Excellence, and he often tells the story of someone that he works with who was a professional who one day gave him a letter and couldn't even talk about it, but gave him a letter that talked about his daughter overdosing on opioids. So it's something that everybody feels no matter where you are.
All right, before I let you go, the challenge is moving forward for healthcare for the state of Pennsylvania. If you had to tick off
So I think it's great that we have expanded quality and coverage, but now we're really talking about quality, making sure that now that folks have access, assuming that access is preserved in some way, but also making sure that they have quality services. So it's not enough that you can go see a doctor, but you can go see a doctor that provides high quality services.
And we have the problem of the shortage of doctors, particularly in rural areas in the state, correct?
Yes, so the coverage is better now. There are certain standards the federal government makes us comply with, but it's certainly tougher in rural areas of the state to go see a doctor or a dentist or a psychiatrist. So we've done all sorts of things. We've done telepsychiatry. We've done expanded the program. We have, I think I mentioned earlier, maybe 15,000 more providers in the system now than we did before. It's still a little more difficult, but it's getting better.
We may end up getting our medical services this way, right, on Facebook or Skype or something where you get it.
The amount of telemedicine that's going on. I was out at UPMC in Pittsburgh, and I saw them. They were actually doing telemedicine for people in South America. I think it was Venezuela. They actually had doctors in a room providing health care to people in Venezuela from Pittsburgh.
Look, I want to thank you for coming in, and if anything happens in your department, you want to come on and talk about it, you just ring me up, as they say. Have a great New Year.
Thanks for having me.
All right, coming up, Cathleen Palm's going to join me. We're going to talk about opioid abuse and how it is affecting children's health. We'll get to that after we pay some bills.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
Well, welcome back to the program. Cathleen Palm, she's the founder and the head of the Center for Children's Justice in the state of Pennsylvania, joins me. We're going to talk about how the opioid abuse now is affecting infants and children in record numbers. Do I got that right?
You absolutely do, unfortunately.
Yeah, unfortunately. Well, there was the increase that I saw in just the last few years, a 250% increase. And that's related to stays in hospital. Now, how many? Well, let's talk about it. What's the root cause of opioid now down to kids?
So we've done a great job in Pennsylvania really helping people understand to what degree overdoses are impacting. But there's this whole other element and lens of the opiate crisis we haven't talked as much about. And that's both babies that are born physically dependent on drugs and young children who are living in homes where parents are overdosing or caregivers are overdosing. But as it relates to babies, there's a condition called neonatal abstinence syndrome. Babies can be born physically dependent on opiates. And it's not just the opiate that's illegal like heroin, but it also can be the opiate that was prescribed to mom for pain that she's now taking, or an opiate that is a legal opiate but mom's not taking as prescribed, as well as methadone, which is for treatment. So you can have a mom who's trying to stay in recovery, but the methadone impacts the baby. And so we're seeing just a tremendous increase in the number of babies that are born physically dependent on opiates, and it's putting a real stretch on our hospitals because these babies, just imagine if you've ever seen anyone in withdrawal, it's a tough process.
Oh my gosh.
And so now you have a baby whose, little belly's affected, they're crying, and so they spend a lot of time in the NICU before they get to be released from the hospital.
Let me just raise this question. You have the data on people who end up in a hospital, a baby in the hospital or a young or an infant, but how about the people who have it but don't get there?
Well, that's it. I mean, I think in addition to the numbers being dramatic about the babies we know that actually get this diagnosis of neonatal abstinence syndrome, there's probably plenty more babies that are being exposed that in that very short period of time that babies spend in the hospital, mom gives birth, 2 days later they're out of the hospital, may not present with symptoms of withdrawal. Yeah. So it may not be until they're at home that there's symptoms of withdrawal. And now you've got a caregiver or parents who are trying to stay in recovery, and they have an infant that's crying inconsolably, has lots of belly aches and things like that. It's kind of a recipe for really a lot of stress, which is also then potentially a recipe for disaster for little people.
Yeah, I mean, the more you think about it, the more it has a cumulative effect across a wide range of family situations that compounds itself and leads to more dysfunction in some families.
Right. Just this week in Dauphin County in central Pennsylvania, we saw 3 very young children, 4, 5, and 6, who were emaciated, allegedly locked up, and nearly starved to death.
Wow.
And if you trace that case back, just the little bit we know so far, if you trace that case back, 2 of those children appear to have been in the custody of the people who are charged with doing this to them, but because a mom gave birth to, was using heroin, was struggling with her own addiction, and so she gave her children to someone else to raise. So there is just a ripple effect to this we haven't really gotten into yet in Pennsylvania.
I'm talking with Cathleen Palm. We're going to run to a break. When we come back, and we're going to how GPS data, well, it's being used in a way you might not be aware. We'll get to that.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, advancing quality, improving lives. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
Welcome back. The topic for this segment, we're going to continue with child abuse and particularly as related to opioid abuse, but we're going to expand that a bit. there's a Children's Justice and Advocacy report that gets into how changes made in the Pennsylvania legislature to the laws in this state have reformed how child abuse is defined and emphasized. And there's this thing now with the GPS system. What is that about?
So it's interesting because for more than 2 decades, Pennsylvania had been providing kind of a two-tier approach to protecting kids. One is the Child Protective Services, which is the child abuse reports we all think of. So someone goes out, investigates, and says, did child abuse happen? But there's this other track called the General Protective Services. And for 2 decades or longer, we were doing it, but we never tracked the data. And now, for the first time in 2015, we tracked the data, and it affirms for us what we always kind of expected. In 2015, there were about 40,000 child abuse reports, but there were 130,000 General Protective Services referrals. So that's when people are calling and saying, we're seeing kids that are left home alone, there's no food in the refrigerator, the parents are out. There are things that you can't necessarily pin as the definition of child abuse, but it still gives you pause about the safety of children. And you're trying to prevent something horrible or even some level of trauma or abuse happening to kids. But so this General Protective Services is huge. It reinforces how much our county children and youth agencies are under just dramatic pressure, particularly in the wake of the Sandusky situation. So what is neat about this is, for all the times we have a tendency to be like, oh, that child welfare system, and be a little frustrated by what we didn't do to protect kids, this is a huge victory for Pennsylvania kids, because we're not only keeping the data and reporting on it, but what used to happen is, if I were a law enforcement agent and I was going out to report on Cathleen Palm, I didn't know whether this was the first time someone had caught about Cathleen Palm or the 5th time that someone had caught about Cathleen Palm. I never knew about the first 4. So now you really have kind of taken, untied the hands of investigators. They no longer are working with blinders on, and they get a clearer picture of what's going on for the child and the family, which is so neat. Not just...
And is the GPS system track and monitor this?
It is now. It was never tracked statewide. We never really had a good idea as to how many children and families were touching our child welfare system. So imagine that for 2 decades, we were providing such a massive amount of services and supports to families. Child welfare systems were going out to it. But if I came to you and said, hey, where was it?
You're confident that this is going to make great inroads in getting the reporting, but that doesn't cure the problem. We're almost out of time, but it doesn't.
No, I think what it does is it reaffirms for us, it gives investigators the information they need, it allows us to help families sooner, and hopefully it allows us, through the General Protective Services, to not have kids be abused. All
right, thanks for coming in. Keep us updated as we see what the progress hopefully will be made. All right, as we said, Happy New Year, and we'll see you next week for another edition of Pennsylvania Newsmakers. I almost said